We ran into February 21st, right, where there was a huge cyber attack against Change Healthcare. From my understanding, this was basically some hackers had got in and said, hey, we have access to the data set from Change Healthcare. And they're saying, hey, pay us $22 million and we'll release the data set. And I think it says Change Healthcare, it says it processes something around 30 million transactions per day, over 100,000 different hospital systems and providers on this system. How'd you think through that process? Think about that hack and thinking through like how to get around this if you can no longer, because what happened was when the hack happened, or United Healthcare just admitted, said, hey, we can't process claims at this time, and they stopped. So basically all these millions and millions of transactions that are happening to process medical billing just completely stopped. So now you had providers, hospital systems scrambling to get compensated, to get paid for work they've done because the clearinghouse was not processing those claims and those claims are not coming back to them. So no one was getting paid during that period of time. High level as a medical builder, how do you handle that and think through that process to get around what was happening here?
We kind of went into emergency and crisis mode with a lot of things. So what we found out, one, there's a lot of clearinghouses that are ingrained with certain practice management. And so Change Healthcare was the preferred vendor for many practice management systems, for many EHRs, and for many payers, actually. So one of the things that we found out that we didn't have a lot of insight into previously, purely because I don't think we ever asked a lot of the questions around it, was there was a lot of payers who, no matter what clearinghouse you used, whether it was Change Healthcare or another like Waystar or Availity or one of the other bigger ones, what really was happening was a lot of these payers were exclusive to Change Healthcare. Even though they had a setup, you were set up with a different clearinghouse, that clearinghouse was then turning around and having to send the claims through Change Healthcare in order to get them to the payers. And what we also found out too, especially here in Arizona where I live, some of the payers actually had their EFTs, so their electronic funds transfers, were dictated through Change Healthcare. So there were some payers that actually couldn't even release payments on the claims that they had. So they had to start cutting paper checks in order to get these providers paid. Really what we did is a couple of different things. And then many of the other payers, you have the option where you can drop to paper, but it takes longer. But then also some of the other payers quickly spun up alternate pathways, whether it was through another clearinghouse, through direct submission, through online portal entry, through online uploads. Going forward, I would say, understand your clearinghouse, understand the limitations, and understand some more about how some of these payers work and how they process, because what's happening is we couldn't get claims out, but then some of the payers couldn't even process them if they got them, and they had no way of finding that out.
The fix isn't more automation, it's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human-to-human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, click the link below, check it out, and give us a call if it makes sense.